Sawadee krap. I am Naravut. I'm from the team of cardiac catheterization lab service of Maharaj Nakorn Chiang Mai Hospital in Chiang Mai University. We are addressing an issue for you regarding to cardiac implantable electronic device therapy, which you may in need. This procedure is a procedure for certain patients, including you, that may get fainted or near fainting, or ever got aborted sudden death from heart rhythm disturbances, or evenly at high risk of cardiac serious rhythm disturbance, which may lead to sudden death, or maybe an add-on treatment for patient with heart failure. And what are those treatments? The treatment is a specific heart rhythm treatment that utilize battery and computer and miniaturized computer system that encase in a metal box working with heart rhythm wire. So there are two entities of this treatment. Firstly, a very common pacemaker, which being permanent treatment, those for treating the patient and regulating slow heart rate disturbance that might be arranged and re-establish contraction sequence in lower chamber, especially in the patient with heart failure, so-called biventricular pacing system, as known as BiV pacemaker or BiV defibrillator, may be abbreviated as CRT device, or other treatment called implantable cardioverter defibrillator, which is a professional treating or standby treating a patient with sudden and fast heart rhythm disturbance to prevent sudden death. These can be incorporated in CRT device as well. Those patients requiring this treatment shall be addressed. Those treatment including existing blood thinner therapy, which may be withhold. These can be made in individual basis, and reservation for operating suite and hospital bed need. We may rearrange it, and clarification contact to you will be made by our personnel. Our hospital number begins with 05393 and follow with other 4 digits. Please accept the call since it is very in necessity to give you the best treatment. The process of the procedure started with informed consent and addressing any concerns that you may give us. Our personnel welcomes all of those questions and concerns. We shall address it at our best to get an informed consent. After informed consent obtained, local skin shall be prepped. An establishment of venous line, including allergic history, a son shall be made to make sure that you will get the best treatment. Prophylactic antibiotics, including sedation or evenly anesthetic service, is subjected to be made and in the individual basis. Then you shall be transferred into our cardiac catheterization suite, which including X-ray system, the table that can be moved to adjust the position to best service treatment. Local anesthesia to ensure your comfort shall be given. Locally, especially the area of the procedure, The procedure requires implanting the device in this size, and wiring system shall be placed through the vein into your heart, and after connecting, the device shall reestablish the rhythm or evenly provisional treatment in case you may need it after monitor. The device is in this size, not bigger than your palm. Maybe as big as this for defibrillator, which require larger battery and ensuring giving you enough energy to reestablish the rhythm in case of fast beating. Certain device developed for any specific anatomical rearrangement, including any prosthetic implantation in priority. So in those patients, they may need a miniaturized device that shall be placed through specific route, especially into the directly into the heart chamber, and leaving you no wire system, or evenly underneath the skin like this. Those shall be made in the individual basis. For the vascular access, commonly we will make it below your collarbone. Rarely, we're going to place it over your armpit underneath the thick muscle covering for specific patient. In necessity, during procedure, we may restrain you because we really need a stabilized positions. Those access we made with or without injecting the dye to ensure our precise treatment. And the wiring system will get into the vein and then shall be connected to the box. These are X-rays showing you how the wire plays. In this, you're gonna see the right upper chamber wire and lower chamber wire in case of pacemaker. In certain patients, they may need defibrillator, which can be well distinct from pacemaker because the wire contain shocking capable wire. And in certain patients, will need two wire in the bottom chamber, either including the left lower chamber wire and right lower chamber wire. And the box will be clearly bigger. And after the procedure, the plaster over the incision will be placed. After the procedure, you really need overnight stay as minimum requirement to ensure completion of antibiotics course as prophylactic, and routine observation for any complication, including bleeding, and a confirmatory radiography and reassessment of device or interrogation shall be made on the next day. Dressing over incision shall be placed minimum stain of the as bleeding spot can be visualized. But after removal of outer covering dressing, which may be required before regular visit 1 week, can happen, and those patients, we leave them another layer of dressing underneath like this. You shall be subjected to be released by the next day morning, but it can be rearranged in case of need. The appointment will be 2 appointments. Firstly, for outer waterproof dressing to be removed by 1 week, and then you may resume taking shower and letting the area wet by that time, but not beforehand. And inner elastane stickers shall detach afterwards by itself. Don't need any intentionally removal. And you're gonna get another appointment in-office visit by 1 month. Commonly here, but can be rearranged at other facility in case to cope with your specific need. You may resume your activities by at least 1 week for wet incision. Your shoulder and arm movement are encouraged, especially on the side of procedure. There is no increased risk of device or wire complication by just regular movement of your arm or shoulder, and there is rare report of any muscle or nerve system injury. Or household electronics appliances are allowed, only except power generator, welding machine, especially larger than 1 ampere, and power drill, or muscle or nerve stimulator, or even large loudspeaker may be giving interference to your implanting device. So you need to step away from it at least 3 feet to ensure safety. In case without any aborted, sudden collapse or fainting, you may resume your personal automatic driving by 1 week. But with those events or evenly commercial transport driving, careful discussion to be made with your physician to comply with the legislation. Other non-serious symptoms or signs can be found, such as swelling or bruise. The symptoms that may warrant for any urgent visit are including new episodes of fainting or near fainting, or evenly relapse of the prior fainting symptoms, or twitching of the chest wall, or skin breaks or discharge from the incision, or excruciating pain in progressive or relapse, need a treatment or attention. And cardiac device specialist is subjected to address those issues for you. Other device may require earlier appointment visit, including more serious bleeding like this, or the bruise that's gonna keep progressing may need earlier appointment if not be informed by your doctor. Certain minor issues such as residue of suture materials sticking out, like this photo or this, requiring removal, or sometimes more concerns such as redness or warmth at the incision. We do encourage those patients with aforementioned symptoms to contact us. Other serious but foreseeable complications, including perforation of heart chamber, nerve damages, adjacent vascular damage, or injury to the lungs or its lining, can be found, but with very low incidence, as low as 1%, those warrant a night stay. All questions are welcome for us to give you the best service. Thank you and appreciate your attention.